This is the second part of my little talks on sex, mainly sexual dysfunction, and also on mental illness, so how the two things relate. Okay, so I think last time I spent far too much time reading from a study, which if you were interested in reading the study, you could read it yourself, and it needs to be from me and from my heart. So this one I'm just gonna, even though it's a fascinating study and I referred to it as the Holy Grail in my last one, basically because it examines sexual dysfunction in severe mental illness from the point of view and from the narratives of the people who are ill, rather than what the psychologists think, what the psychiatrists think, what the GP thinks, those things. So this is called, this study, this one here, look at me, you know, you'd think I was intellectual or something. I don't even have GCSEs, I have nothing. Every time I go to college it just goes drastically wrong, or something happens in my life or I get ill again. Stigma and the sexual isolation of people with serious mental illness, and they've done a study. So Eric R. Wright, Dustin E. Wright, Brea L. Perry, and Carrie E. Foote, Ardah. I think Carrie needs to delete the Foote from her name and just be Carrie Ardah, and delete the E as well. And most of this is from Indiana University in Indianapolis, apart from one person who's Medical College of Georgia, that's Dustin E. Wright. So I'm just going to quickly, as a lay person, you know, I've never studied these things, and I'm not a practitioner, I'm just a person, and I'm not that bright, I'm just normal. So what they did was they were looking mainly at stigma of mental illness and how that affects sexual functioning. How this study was set up in the first place was that they were doing a study on HIV in vulnerable people, and mentally ill people, severely mentally ill people, are very vulnerable to things like sexually transmitted diseases and things, and all the rest of it. So they were doing a study on that, and this is what came out of it. And what they kind of like worked out was by listening to the person's narrative, they were sort of taping them and listening to them and giving them sort of a 90-minute interview. That the 8 major themes came out, and they kind of disagreed on how many themes there were, but they eventually settled on 8 major themes. So what I want to do is just focus on those 8 themes from my point of view, just from me. If I really would, even if you are a patient like me, this is not one of the really difficult ones that are impossible to read, and it's free on Google, so it's not like one of these really expensive textbooks that cost a ridiculous amount of money. So maybe look it up and see if it's called Stigma and the Sexual Isolation of People with Serious Mental Illness, and yeah, have a look. I'm going to find for you the 8 major themes, because they put them together in a little format here. It's like a little right, okay, and say how it relates to me, because I think last time my video was too dry and no one's gonna watch it really, are they? Right, poor access to sexual partners. Theme description: lack of access to current or potential suitable partners. Now, what you've got to bear in mind is when someone's mentally ill, not only are they in hospital a lot of the time, or going to appointments and things a lot of the time, but they will also not be working if they're very ill. Sorry, I'm moving my computer because it overheats really, really quickly, and I don't want it to cut out. So they, they're failing at college, they don't get out much, I don't get out much, so there's a lack of people that you're meeting who are potential potentially suitable for you. Because sometimes, I mean, for me, I don't even go to things that are just for the other mentals, like myself. Like, there's really great things I could be doing right now, and I don't do them because I isolate myself. And because it's so hard to be stable and predictable when you have mental health issues. So, experiencing sexual dysfunction, low libido, erectile dysfunction, mental or physical health problems, and age. So some people, it might just be their age and they're really not bothered about having sex anymore, though I know lots of healthy people in their 60s are having better sex lives than me, trust me. So sexual dysfunction and low libido, that can be caused, of course we know, by depression and anxiety, but also by tablets and things. And erectile dysfunction in men, that's a whole other issue. And if you are experiencing that, I really feel for you. It must be very difficult and it's very hard for you. Yeah, except it's not hard. I really recommend going back to your psychiatrist and being brave and saying what's really going on. Okay, psychosocial difficulties, forming relationships, concerns about intimate relationships, history of abuse. So the psychosocial development, it means maybe we're just not very good at making relationships, at forming relationships, and also the history of abuse. If you've been abused, if you've been through God knows what, it makes everything so much harder still. I'm wearing a blue dress now. I was wearing a red dress in the last one, just to make it more interesting, my stagnant videos. The next one, so that's 1, 2, 3, 4, fearing disease or pregnancy. Fear of HIV, AIDS, STDs or pregnancy. And when they spoke to people about this, you know, sometimes there's a real fear of getting a sexually transmitted disease, and anxiety disorders can increase that and make you more frightened of that and make it really a big issue for you in your mind. But also the fear of getting pregnant is partly because you think, well, I can't cope. I couldn't cope with a baby, and that may very well be true. So that's a very real fear. And then there's also the very real fear. My daughter now, she's okay, but she's been assessed, but I don't normally talk about, you know, my children, but you know, for a while I was very frightened that she would have a severe mental illness like me, and I'm always watching out for the signs of it in my son. I've got my son and my daughter, and that's a very real fear. Why would you want to subject a child knowingly? I mean, I had my children when I was really young, but why would you want to subject a child knowingly to this? I wouldn't wish this on my worst enemy when I've been at my worst. God no. Moral and quality of relationship concerns. So they've explained that as behaviour due to religious, moral or quality of relationship concerns, desire to be faithful as a partner. And what you'll see is a theme throughout this, and a theme when you speak to people with schizo affective or with schizophrenia and other psychosis, you'll find that we place a lot of importance on religion, and even the atheists amongst us tend to have very strong moral convictions and humanistic principles that they apply in their lives, but a lot of us are quite preoccupied with religious concerns. And as we know, most doctors are atheists. You know, certainly in the UK, most people that are treating you are atheists themselves. So, and the ones that aren't are Buddhists, and they don't always quite understand how deeply concerning it can be to you that a relationship does not have the good morals, and it's not from the right religion, or it's not, you know, it's sex outside of marriage. So people are concerned about that. They want a good relationship. They are not willing to settle for less. I think when you've been through hell and back, you know, you want someone who's going to commit to you. You don't want to keep messing around and taking chances. You just want that love and that commitment. And after reading this, it makes me feel like I'm not so alone in thinking this. A lot of people with my illness are thinking the same thing, that we don't want to have our hearts broken again, and we want things to be right and to be good. Sexually restrictive treatment cultures and settings, rules or policies prohibiting sex in treatment settings, references to institutionalization or incarceration. So, you know, when you're in hospital, they probably completely discourage sex, because I've never been sectioned myself, but I would imagine they would discourage it because it can cause so many problems and things for the nurses and doctors to manage, and they can just have an aversion to it all anyway. The thought that their patients are getting up to stuff. So that's an important part, is that in the institutions themselves, and even in the fact that you would go for therapy or see your psychiatrist, and your relationships or your romantic attachments are never really discussed properly, because mainly because they don't want to talk about it. I think the nurses, doctors and everything, they're very uncomfortable with this. And as I said in my last one, oh god, what did this hairdresser do to my hair? I said in the last one that you know, it's like how can I explain it? It's like they freak out. They freak out when you bring this issue up, and there needs to be someone who is not going to freak out, who you can speak to about this. And again, in the last one, I kept bringing up, you know, people with severe mental health issues do want to talk about these things. They do, and they do want to resolve it, and they do see it as a part of their recovery and a part of their future happiness. And I think it's from the institutions and from the treatment centres that we're discouraged, and we're discouraged to even have relationships. I mean, there's some treatment programs you can be in and you can't have a relationship while you're in them. So everyday life with mental illness gets in the way. Oh god, yes. And this is a perception that sexual expression was difficult due to competing responsibilities, or that sex will negatively impact rehabilitation. Well, basically this was done with people who were in recovery, and it was based on whether they'd had sex in the last 3 months. So it's people who are specifically trying to recover and have been quite ill and are trying to get better. So you can completely understand why they might think that right now I'm not ready for a relationship because I need to get better first. But also, everyday life with mental health illness does get in the way, because when you want to sleep all day and you are unreliable and you will stay up all night with crazy thoughts going through your head, and you have to take these tablets, and your whole life revolves around taking tablets and appointments and things, and all the rest of it, you're pretty preoccupied. It's pretty busy. So it doesn't leave much space for romance and sex. And the last thing they had was feeling devalued and withdrawing from others, and they really sort of explained this to do with stigma in the study. Feeling undesirable as a partner, avoidance of discrimination or community sanctions. So basically, you know you're a nut job, okay, you know how people see you, how people see your illness, even if they don't see that in you, but you feel less, and you think that maybe you have to be really well before anything can happen, and you're very much affected by how society sees you and by your illness, feeling less than. People with mental health issues have severe sort of self-esteem issues. So I think I'm just going to run through and just quickly tell you them again. Poor access to sexual partners, hell yes. Experiencing sexual dysfunction, I felt dead from the waist down. Psychosocial difficulties, forming relationships, yes, definitely. I'm not that mature. It's like my mental health is like in Girl Interrupted. My mental illness has just interrupted me, and I've had years of being mentally ill instead of growing as a person and being at work and learning how to be a professional person, and all these things haven't been available to me because I've been busy being mad. So fearing disease or pregnancy. I know someone who's who've got an anxiety disorder, and that is a huge obstacle to them having sex, is that it's become almost a psychosis, their fear of cervical cancer. Moral and quality of relationship concerns, well, this should concern everybody, but we seem to like, kind of like, on the one hand, have higher standards, us who are ill, because we're so afraid of being hurt and abandoned, and on the other hand, no hope that we're ever going to get these things. So these things concern us. Sexually restrictive treatment cultures and setting, and this can be also to do with your own personal life. If you're from a religious community like I am, where there is no sex before marriage, you know, there really shouldn't even be any kissing before marriage, before something has been set in place that you're going to be with this person. That's the background I come from. But the point is, the people in these communities don't want to help the mentally ill get married, because I think people just think we should just go away and be mentally ill and get over it, and we're not suitable partners for anybody. And what they found in this study as well was that people with mental illness don't want to form relationships with other people who are ill in hospital necessarily. They might want somebody who's sane or stable or whatever. One of the fears, one woman expressed in this was that, well, we're both going to be broke if we're both mentally ill. And that's true. Because how are you going to hold down a job, and how are you going to be able to pay your mortgage if you get to that point, and all the rest of it, if you keep having to take time off to be ill, or you can't even wake up in the morning because you're so drugged up, or you haven't slept the night before because you've been hearing things, seeing things, experiencing things, thinking about things. It's very hard. So everyday life with mental illness gets in the way. I think that's pretty self-explanatory to anyone who's been around anyone with mental illness. And feeling devalued and withdrawing from others. So there's a huge self-esteem issue there. Feeling undesirable as a partner, feeling like, what have I got to give? You know, all these people that are out there and they're well and they've got these great jobs, or they've just got these normal jobs and they live in normal houses and they're doing normal things, and I'm a lunatic and who the fuck would want me? All these things. But, you know, one second, you know me with the cigarettes by now. You know, after reading the report, I kind of thought to myself, because they're taking a detached viewpoint as psychologists doing this study, they're writing these points of view down from the point of view of the mental health person, and I thought a lot of them might not necessarily be true. You might be really seriously devaluing yourself and devaluing what you have to offer and what there is available and how you could handle it and all the rest of it, because you're assuming there is this big block. Do you understand what I mean? I can't really explain it better than that, but if you look at it from an objective point of view, maybe some of the things that you or I think stand in the way of satisfactory relationships and sex and all these things, maybe we've built them up in our heads to be far bigger obstacles than they actually are. And that is something that, yet again, I think there should be like sex therapists and relationship therapists on mental health teams, people you can go to with these issues, because they could help you work through this. And you know, like if you do like cognitive behavioural therapy, I'm not a fan of it really and truly, but there's some things it can do in the sense that you'll come in there with this huge idea that something is impossible and it's never going to happen, and then when you actually sit and objectively think about it, you'll realise, actually, I built that up in my mind. That's not necessarily true. You know, and maybe not everybody else thinks that. And I think that's something that could really, really work when it comes to our intimate relationships, when it comes to how we think about ourselves and our self-esteem, how we think about our illness, that we think it's insurmountable, we're never going to get better, and that every year you find you're getting better somehow. It's all really important. So I hope this was a little bit interesting. Maybe one day I'll learn to cut videos and I'll be a proper Jenna Marbles or something. It's unlikely. Anyway, take care. God bless. The next one I really need to think hard about. I really think I need to talk about abuse, sexual abuse and violence and those issues. Okay. God bless.